When I was in school, I learned that balance was static or dynamic and that we could categorize it as objectively as possible. Fair, good, poor, loss of balance ×2 with independent recovery. Or we document contact guard assist to complete tasks. I also learned that a patient's fall risk is incredibly important to their rehab potential and ability to remain safely in their home. I learned a fall can lead to hip fracture and can significantly change a person's life trajectory. But what I didn't learn about is, what is balance? What is responsible for having good balance? Is it muscle weakness? It of course can be a factor, but typically it is not the root of poor balance. Balance in general has 3 major components. The first component is our eyes. Our eyes are taking in information. They're telling us where we are in space. The second is the vestibular system. We've referenced this system in other videos. There is the peripheral and the central processing of the vestibular information. The vestibular system is telling us where we are and where we are moving. The third is our cerebellum. It's like our mini brain. It plays a large role in balance and coordination. When we are standing on one foot, if we are relying on chunk reactions and the upper body is swaying, that is a sign that our cerebellum is weak. We should be seeing the ankle and the toes do most of the work while balancing on one foot. With this information, you can see that it is possible to strengthen balance by exercising these different parts of the brain. When we practice standing on one foot or a balance cushion, we are stimulating and providing input to the cerebellum. But what if, when we are practicing balance, we are only strengthening the trunk reactions and not realizing that we need to downgrade the task to stimulate the cerebellum? Remember, when we activate the ankle and toes, we're going to stimulate the cerebellum. Or maybe my balance task is too difficult for the patient. What other ways can we provide input to the cerebellum? How do we determine if it's primarily the cerebellum or a vestibular issue? These are all important things to consider while treating balance. Please keep in mind that the brain is complex and many systems are interconnected. Therefore, this is a simplification of balance. In general, the brain needs constant and accurate feedback from many systems about where we are in space and where we are moving in order to respond and maintain upright posture and balance. Thanks for listening, and you can check out more videos about how we can exercise regions of the brain to improve patient outcomes. My next video relates to how the cerebellum is involved in fine motor skills. Check out our website for reference articles, cnsitherapies.com.